back in the day, we would just see like basic PMS. And now we're seeing these really involved cases of like autoimmune cancer, chronic disease. And oh, by the way, they have PMS. And so I think our, unfortunately, health, society, just quality, world quality is really deteriorated. Hormones are very reactive. They're very dramatic. They are the canary in the coal mine. And so when we don't know how to define something, especially female, because we are used to cycles, we will say, oh, I feel so hormonal. God, I'm so hormonal today. We don't know what it means, but we say it. And so when we go to the doctor, we're like, I don't know. I think it's my hormones. Not realizing it's like everything else that's happening. But I am seeing, and I am definitely hearing men younger and younger and younger coming in saying the same thing. Now, they may not say I'm hormonal, but they're like, I'm more tired. I can't lift as heavy. I'm not motivated. I can't sleep. I have more anxiety. And they're in their 20s.
Hey, this is Chad Namiro.
And I'm Kelley Namiro. Welcome to the Balancing Chaos podcast,
a lifestyle podcast where we will interview guests about wellness, business, and just about everything in between.
Our goal is to help you develop a lifestyle that promotes health, wholeness, and success. Through our conversations, we hope to inspire you to live a beautiful, full, and joyful life as you navigate balancing the chaos.
We hope you enjoy.
All right. On today's episode, we are honored to have Dr. Carrie Jones, a renowned functional medicine, health, and hormone practitioner. Driven by her passion to educate, empower, and entertain, Dr. Jones has spent over 17 years in the field of functional and integrative medicine, specializing in naturopathic endocrinology. As a speaker, educator, and board-certified expert, she has traveled the world sharing her expertise on health and hormones with both healthcare professionals and individuals seeking to better understand their bodies. With her real talk approach sprinkled with sarcasm and funny analogies, Dr. Jones cuts through the complexity of hormonal challenges, helping hormonally challenged people feel less crazy. Get ready for an enlightening conversation filled with practical insights and empowering knowledge as we dive into the world of hormone health with Dr. Carrie Jones. Welcome to the show.
Oh my gosh. Thank you so much for having me.
We're super excited. This is like my kind of, interview. I'm really excited. This is like right up my alley and what I try to coach on, but you being a doctor, I am, being somebody who goes and educates, I know that you have so much information and are a wealth of knowledge to share. So we can't wait to dive in.
We didn't grow up with hormone education, right? Like we just, we learn the basics in school. We get our periods or like how to not get pregnant. And then we're sent on our way and it's like, what the heck? We're sort of floundering around in the world, and thank God for social media to some degree, but yeah, that's sort of my mission.
It's even more so for guys. I feel like I honestly didn't know until like recently that men carried estrogen in their body.
Yeah. It's very true. Yeah.
Yesterday we were having this conversation of DHEA converting to testosterone and estrogen and all these different things. And he's like, I didn't even know that. Like I had no idea that men even had any estrogen at all. And so I think we should try at some point throughout the conversation to kind of talk about the difference in balances, both in women, because a lot of our audience is women, but also in men too, because like what Chad said, like we have a good group of male listeners. And I think that the conversation, women are not just hormonal, men are too.
That's the truth.
So talk to us a little bit about what kind of led you down this path of functional medicine and hormone health.
It's actually a lot of that. So I live in the Pacific Northwest, but I grew up in Kentucky, of all places. And our sex education, health education was taught by the football coach. So you can imagine how that went in the South. And when I was in school and I moved out to the Northwest, I was planning to go to medical school, and I found naturopathic medical school, which leans really heavily into obviously natural, holistic, integrative, first, and then conventional medications, surgery second. And that was the route that I really wanted to go. And I moved into the hormone realm. I did my residency in hormones and endocrinology. And over, I would have family members, friends, colleagues be like, I didn't know that, sort of like Chad didn't know that he has estrogen. I had a lot of women. I would have women that had been married, kids, and they were like, I didn't know how that happened.
Right.
Yeah.
I don't know how my menstrual cycle works. I didn't know these things, or they'd hit menopause. They're like, what is this thing, Carrie? I don't know what's going on with me. And I thought, all right, this is my life mission, is to educate. Because I feel if we, men and women, but I'm predominantly in the female world, if we just knew the 101, maybe the 201 level of how our bodies worked, it would solve a lot of problems in the health world, right? Imagine if you just knew what was considered normal, what was abnormal, and normal is different than common. Common is accepted. It doesn't mean it's normal. And then maybe some things on how to fix it or how to address it or what causes it. Like imagine if we learned that in school or got a refresher class every decade. I think it would just help so many medical visits, frustrated people. You know, you see it in social media, you see it in the comments, you see it in the DMs of very frustrated people who are trying so hard to thrive in life. And they're just not, they didn't get the answer. They didn't get the education. So that's what got me into it.
Would you say that hormonal balances are the highest they've ever been per capita?
Or people are just more aware of it?
Or
I think definitely people are more aware. Both. I would say both. So when I was really at the height of my practice, I obviously hormones is what I did. So that's what I attracted a lot of. But now, and my mentors were like, oh my gosh, before back in the day, we would just see like basic PMS. And now we're seeing these really involved cases of like autoimmune, cancer, chronic disease. And oh, by the way, they have PMS. And so I think our, unfortunately, health society, just quality, world quality is really deteriorated. And hormones are very reactive. They're very dramatic. They are the canary in the coal mine. And so when we don't know how to define something, especially female, because we are used to cycles, we will say, oh, I feel so hormonal. I'm so hormonal today. We don't know what it means, but we say it. And so when we go to the doctor, we're like, I don't know. I think it's my hormones, not realizing it's like everything else that's happening. But I am seeing, and I am definitely hearing men younger and younger and younger coming in saying the same thing. Now, they may not say I'm hormonal, but they're like, I'm more tired. I can't lift as heavy. I'm not motivated. I can't sleep. I have more anxiety. And they're in their 20s. They're in their 30s. So like, I can't get an erection. I have zero sex drive. And I don't care, you know? And we would hear that when I first started practice in 2005, 50s, 60s, not uncommon.
Yeah.
Now I'm 26-year-olds, 27-year-olds DM me and they're like, look, I know you don't see men. Where can I go? Because here are all my symptoms. I'm like, wow, you were, quote, too young for that. But in our society and day and age, unfortunately, it's becoming more common.
I just want to take it back for 1 second, because I think that this is so interesting what you were saying about, you know, why you got into this practice and like how people just like don't know. I want to hear your opinion on like conventional medicine as well, because I had a client who I was dealing with, you know, I do 6 months with people. And when she first came to me, she was like, you know, I've gained all this weight. And then my doctor put me on SSRIs and all this stuff. And then I said, well, what does your thyroid look like? She's like, well, we did a TSH level and they said it's normal. And I'm like, but what else? Like, have you looked at the whole thyroid? And she's like, no, haven't looked at the whole thyroid. They said that because TSH was normal, we didn't have to do that. We looked at her thyroid and her T3 was low. And we know, like, I know that like, that's a big piece of serotonin production. And so it's like, when we get that fixed, then she's happier and she's also losing the weight that she wants to lose. So, but like a conventional doctor is the one who slapped her on the SSRI in the first place. So can you talk a little bit about like, if somebody comes to see you and they're like, I've seen this doctor and I've seen this doctor and this is what they told me what to do. What is your belief on in terms of conventional medicine, and are all doctors out there kind of, you know, not necessarily as educated in this holistic approach?
So I'll give you a couple examples. And I worked in the conventional realm for a while. I worked in an integrative clinic. We had MDs, physicians assistants, nurse practitioners, and they blended it with us, naturopathic functional medicine, which was an amazing clinic. But when I was getting recruited to work there, I would share a lot of patients with the MD, and we were flipping through chart notes through labs. And she said, oh, her TSH is high. Her antibodies are positive, whatever that means. And she kept flipping the lab. And I said, well, hold on, she has Hashimoto's. And she's like, I don't know what that means. And she was a primary care. She'd been primary care. She'd been a chief medical officer of a large clinic in town before she branched out on her own. And she goes, I don't know what that means. And I said, well, it's autoimmune thyroid. She has an autoimmune condition. And she just like stared at me like, what? Okay. Like, yeah. Like, what does that change? Now, fast forward, that very same MD has gone through all the trainings. She's totally functional medicine certified. She's completely changed her tune and is like, gets it, which is amazing. But back, I mean, to her, it was like, who cares that her antibodies are high? Like, you know, I don't care. And then I have a good friend who is a gastroenterologist internist. She's double board certified. And she was branching into functional medicine. And she said, she's mother, she's in her 40s, she's like, can you just run the menstrual cycle by me again? And I was like, I'm sorry, what? She goes, can you just like explain the menstrual cycle to me again? I'm like, you've had children, you're a woman, And she goes, I know, but like, I'm a GI doctor. So that's not my area. That's not my hole. I'm in the other hole. So can you just explain the menstrual cycle? So nobody had ill intent. Nobody was out to hurt their patient. They just literally were not trained. And then my own primary care is I sometimes see a PA when my MD's not available. And he said, what do you do again? And I said, hormones. And he goes, I do not touch those. And I was like, what do you do then when your people come in and they say they feel hormonal? And he's like, I don't know, but that's not what I do. That's way too complicated for me. And I was like,
oh God. Yeah.
You're such a disservice. So again, I don't think it's vindictive. I just think they have 6 minutes per visit. Their training is what their training is. And unless, just kind of treat them and street them. And thank God we have acute care. Thank God we have functional medicine, or conventional medicine. But when you want something deeper and more integrative or functional or understanding, they don't always shine in that area.
Totally. I could not agree with you more. And I think that it does come back to the 6 minute thing, or like however many, short minutes a visit is. It's like, you can't cram it all in that time frame. And so for all of those people out there who, like you had said at the beginning, there's so many people out there that are like, I don't feel good, but like, this is normalized, right? And like, this is what I'm told, like, I'm getting older, so I should be gaining weight, or I am getting older, I should be lower in energy, or whatever it is that they're being told. Like, where do those people start, and how do they start to approach that issue? Is it with lab work? Like, what's the answer there?
First of all, they listen to your podcast and they get and I think, unfortunately, we originally were taught when you go to your doctor, they're just going to handle everything. And now in this day and age, thankfully, because of social media and because of online platforms like podcasts, a lot of people are waking up and they're getting self-educated, which is good and bad, right? Sometimes you know not enough, but end up doing more harm. So, but I'm all about, you live in your body, self-educate as much as you can around what's going on, read the books, listen to the podcasts, follow those people on social media. And then you can start with your primary care, whoever you see, because if that's where you feel comfortable, if that's the first person on your clinical team, fantastic. And from there, though, you may need to add people to your clinical team. And I always want people to listen and understand you shouldn't feel like you're hurting feelings, and you shouldn't feel like you're cheating on your primary care. Like, add to your clinical team, because your doctor can't do everything, right? Like, if you need to add a coach, if you need to add body work, if you need to add mental, emotional, if you need to add diet and lifestyle, like whatever you're doing, it's totally okay to add. But you're probably going to have to branch out into that functional, integrative, holistic, takes more time with you, learns your whole story, runs more deeper lab work, because you have comprehensive, complex issues. Therefore, it's going to require a comprehensive visit and maybe some more complex blood work. Now, some of the blood work you and I would argue is not complex. Insurance would say is complex.
Right.
So, like, we are thinking a basic blood work panel to us is for thyroid more than one marker, but to insurance companies, they're like, well, it's just one marker. That's all we're covering.
Right.
And it's foreign or weird or out there if you order more than that one TSH marker. Where to us, we're like, no, it's actually pretty normal to run these other markers. And so it's really just putting.
Is that why they're resistant to like, because I know I've like, before I was able to run lab work on my own, like, and order it for clients, like I would have people go and say like, okay, go to your doctor and ask for like TSH, T3, free T3, free T4, reverse T3, like ask for all these things. And then they're come back and their doctor would be like, no, we're not doing that. It's because of insurance.
Yeah. It's because, and they're training. They're literally trained. Start with TSH. It's the dogma, how they're trained. Start with TSH. So I was having heart palpitations last year and I just wanted to run it through insurance. So I went to my doctor and I was like, can you run this full thyroid panel? And she was like, well, I'll run a TSH and we'll kick it to T4 if your TSH is high. And I was like, I mean, not to be egotistical, but like, do you know who I am? Like, I understand this. Can you please just run at least a T4?
Right.
And it was begrudgingly. And she was like, okay. But I'm like, lady.
Right.
So then I had to go and add on the other markers and pay out of pocket, which not everyone can do. Not everyone that can fit in their budget. And so that is so frustrating. And then certain insurance companies actually have it written in their bylaws. They won't. They won't run a T3. They will not run a reverse T3. They will not run antibodies more than once or twice, depending. I mean, when I was in practice, I've definitely worked with insurance companies where they're like, I'm sorry, that prior authorization is no, because in our laws, we don't do that. I'm like, I'm not asking for a cancer marker. I'm asking for a thyroid marker, like nothing wild and crazy or experimental, a physiologic marker. But no, it's like vitamin D now. A lot of insurance companies won't run a vitamin D anymore on you unless you're already clinically diagnosed low vitamin D. How are you supposed to know unless you get tested? So people are paying out of pocket for vitamin D just to get a baseline because they know their insurance company won't pay.
Well, they need a diagnosis code, right?
So you need a diagnosis code, but if your diagnosis code has to match, like, for example, if you don't know that you're low vitamin D, you can't put that as a diagnosis. Yep. Exactly. We can try to get away with other things. And I mean, get away legally. I mean, like fatigue or, joint pain, headache, like we can try to come up with other symptoms that maybe low vitamin D can cause to try to get insurance to cover it. And sometimes it works. And sometimes they're like, no.
That's sort of unfortunate. I ran a full panel actually this morning. So the hole in my arm. It was an extensive one.
Thank you for that visual.
Yes.
But it was probably, I don't know, 10 or so vials. There's a lot, but it was, just shy of $600.
Yeah.
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 So,
which is you and what you were ordering. Granted, you were beyond obviously the normal standard.
Right.
But I would imagine if you were to show me what you ordered, I'd be like, yep, sounds pretty typical to me.
Yeah.
But insurance or maybe your primary care is going to freak out and go, oh, that's too extensive. That's too much. I'm like, it's just complete. We're trying to be complete because people don't feel complete. They're coming to you feeling terrible.
Seems like social medicine-esque.
Yeah.
That's how we do things. Like, for instance, when my sister was doing IVF in Copenhagen, or she was trying to have a child, they needed her to do I think it was 7 rounds
of IUI before they allowed her to go through the process.
So you need to have this, and then it needs to be validated or verified, and then you can do this. And it's kind of, you can't have one without the other.
While we're on this,
it's the same here though with imaging. I don't mean to cut you off, but I mean, think of knee pain, right? Think of knee pain. Like you have to fail an x-ray before you can get an MRI. You have to fail physical therapy before you can get an MRI. I'm like,
God.
Yeah.
Okay.
Don't we want
just
people to
spent
get
all this
better?
money? Yeah, exactly. We just spent all this money for an x-ray. Even if the doctor's like, I am really pretty sure you tore an ACL, you should get an MRI. It's like, well, no, you have to get an x-ray and fail it, which means they can't see anything. Yeah. And then you have to fail 6 weeks of physical therapy, and then we can get an MRI. So now you're months in
pain.
And pain. The insurance company's out an x-ray and physical therapy before they'll do an MRI. Especially if the doctor's like, I really think it's, like, can we please just do it versus I actually don't know. Let's try physical therapy.
So what I want to go back to is like, based on what Chad had said about, the fact that he got like all this blood work done, and we were just talking about men, you were like talking about some of the symptoms, right? Like low sex drive or like low motivation. Let's talk about men and women. What are the most common hormone imbalances that you see in both sexes?
And what's causing them?
Well, what's causing them?
That's a loaded question, right?
All the things. So all the time in a cycling woman, often we will see what we call estrogen dominance or estrogen excess relative to progesterone. So the progesterone should be making heaps, copious amounts, milligrams, and it's not. And as a result, your estrogen is sort of winning the ratio, or itself is actually making a lot. And so she feels PMSy, she feels bloated, she feels puffy, her periods are heavy, maybe she has fibroids or polyps. She has all these things. And so
are things like PCOS and endometriosis, and I know the answer to this, I'm just asking for our audience, caused by that estrogen dominance?
Related, but not caused. So
Okay.
endometriosis can be worsened by estrogen and the way estrogen detoxifies,
Mhm.
and can be worsened by a lack of progesterone, but that is not the cause.
Okay.
And PCOS, depending on the PCOS, so some women with PCOS do have regular cycles.
Mhm.
Some women with PCOS don't cycle. They'll come to you, right? And they're like, I've been diagnosed with PCOS. I haven't had a period in 6 months. They generally have low estrogen because they haven't had anything in months and months and months, whereas others do have high estrogen and it is contributing to their symptoms.
Okay.
The most common phenotype of PCOS is an insulin related, right? Testosterone type of PCOS.
Right.
So estrogen can be all over the board, but high estrogen can make them worse. Yeah.
Okay. So
Yeah.
estrogen
It's not the
dominance
cause.
is like the main or one of the main things that you see.
Probably
in
the
women.
more common thing that we see in women. Yeah. Now you can have low estrogen, like obviously there's all different types, but that's probably the most common thing we see now.
Okay.
A lot of reasons for it. Chemicals in the environment is a huge one. They're estrogen mimicking. They affect the brain. They affect the ovaries. They affect that communication. Our complete, like disregard for our circadian rhythm. We're up late on our phones, TVs, tablets, right? We don't sleep really well. We're drinking. We're not eating that healthy. We're not hydrated. And so then we wake up the next day and fuel with coffee. Everyone's in intermittent fasting. And so they're starving. Now their cortisol's pissed, their blood sugar's pissed. And I'm not knocking it. I'm just like a kind of a worst case, like a commonly worst case scenario thing.
How to ruin your hormones.
Exactly. This is the starter pack right here. And stress. Oh my gosh. And remember, stress, stress is mental, emotional stress, but it's physical stress. It's chemical stress. It's like a lot of things cause, exercise can be stressful. Too much exercise is a problem. So a lot of things are stress. So these are all common reasons. Medications, certain medications will suppress our ovulation, therefore suppress our progesterone and affect estrogen. And so you add this all up to your bucket of life and all of a sudden it overflows and you feel terrible. And you're like, I think I'm hormonal. Yeah. And you are. So, and then you add cortisol on top of it and it's a whole hot mess.
Is it the plastics? Chemical wise?
Yes, that's a big one. Yeah. So plastics, parabens, phthalates, the forever chemicals, which is like your Gore-Tex, your perfluoros, PFASs, your pesticides, depending where you live in the world and around you, your pesticide agriculture, even hobby farms, I mean, at this time of year where all of us are in the Northern Hemisphere, you walk into any Home Depot or Lowe's and like, there's your Roundup, like stacks of Roundup. For people's gardens, and they just don't know because they're like, I have weeds, I don't want weeds, and then that's what they spray.
So for a woman, cycling woman who's still having a menstrual cycle, what does she want her estrogen to progesterone ratio to be?
So I predominantly look at a test called the Dutch test, and it's a visual, thank goodness, because a lot of people are visual. So when the Dutch test results, it looks like they're dials. And so it's kind of a gas gauge. And so when on the gas gauge, if gas gauge is higher than progesterone, I'm like, ta-da, your estrogen relative to progesterone is out of whack. The cool thing about the Dutch test and other urinary type testing is that it looks at the breakdown products of estrogen. They're called metabolites. They are also estrogenic. So you can be, quote, estrogen dominant at multiple levels. You can have these breakdown products also floating around, causing estrogenic type symptoms. And you can have estrogen-like chemicals floating around, binding to your receptors, activating them. And now you're like triply estrogenic relative to progesterone.
Okay.
So it can be a whole mess.
Yes, it sounds like it. So I know what the Dutch test is. I've ordered it for clients before. Can you talk to us a little bit more about other, I know, like, let's talk about cortisol and all the other things that it shows. And like, if a man wanted to do some sort of testing, like how would you guide him?
Yeah. And he can do, the great thing is that, everything I'm saying, even for female estrogen excess, estrogen dominant, can be applied to men too. Because men make estrogen, is now Chad knows, he makes estrogen and high estrogen, and it comes from testosterone and it comes from DHEA. It converted. Right. Yep. And from aromatase. And that aromatase enzyme can be activated. You can genetically have fast, but like high insulin, high triglycerides, high inflammation can activate that enzyme.
Mm.
And so that's why younger men who are inflamed, high insulin, high triglycerides, are having all this estrogen causing the breast development, the belly development, mood changes. So they're more weepy, sad, depressed, less motivated, fatigue, low libido, erectile issues. And so they go in for testosterone, but really they've got all this excess estrogen floating around their body. And men and women detoxify estrogen the exact same. It's the same pathways, the same cofactors, the same everything, which is really great. So when somebody is reading social media on, or a blog or something around estrogen clearance, it applies to everybody, which is wonderful. So the same things I would tell Chad, I would tell you, and vice versa. It's
right,
because it's the same. And that's becoming more common. When your original question was what do I commonly see? I am seeing commonly men, you might truly have low testosterone, or you may have all this excess estrogen that feels like you have low testosterone.
if
That's
a man,
become common.
if there's another reason for a man to have low testosterone, what would that be?
There are a couple. Chemicals is a big one.
Yeah.
Chemicals can impact his those cells' ability to make testosterone. Brain issues are a big one. Traumatic brain injury, especially men in sports, men who've crashed and burned, men accidents, men in military, because the signal to make testosterone it comes from the brain. Same for females. Men just statistically tend to, have more traumatic brain injury and brain issues. Hypothyroidism, which we often get taught, well, women get thyroid issues more than men, but that's changing some. And I think it's just underdiagnosed. Men are developing thyroid issues, and nobody was checking in the past because, quote, that's a woman's issue. It's definitely a man's issue.
When you see hypothyroid, if it's not Hashimoto's, do you attribute a lot of that to the adrenals?
It can be a lot of things, because remember, all your hormones are like the canary in the coal mine. So you have a lot of reasons why your thyroid is down-regulating, pivoting, not converting, deactivating. So there's a lot of reasons but the other hormone for men that also applies to women is prolactin, and it gets forgotten in men. So prolactin is prolactation hormone. We associate it 100% with breastfeeding. Men make it as well. And when it rises even a little bit above range, then it can suppress and affect his testosterone, just like it can affect her cycles and cause her cycles to be irregular and kind of throw off her hormones. So the worst case scenario with prolactin is a prolactinoma, which is a type of non-cancerous tumor in the brain. But hypothyroidism can cause prolactin to rise, lack of B6, being B6 deficient, lack of dopamine, low dopamine can cause it to rise. So there's a few reasons besides a worst case scenario. So in fact, I was sitting on a plane doing a men's health lecture. So I had my slides open, and the gentleman next to me said, I'm really glad you talk about prolactin in men. At the time, he was probably in his 20s. And he said, I had all the symptoms. I had low libido, low energy, gaining weight. I felt awful. My testosterone was low, and he turned out to have a prolactinoma. And he's like, nobody wanted to check this out on me. Nobody wanted to look at this because I'm a man. And he goes, that's the problem. I have this tumor affecting my testosterone and estrogen. And since that time, I've had plenty of men come up to me in conferences, or if they see my slides in social media, and they're like, that's me. I had elevated prolactin. They didn't have a tumor, but they were like, turned out I was hypothyroid and it was driving up my prolactin, and that's the problem. I had a double whammy. So instead of just jumping on testosterone replacement therapy, I'm like, well, we have to address the issue, which is thyroid B6 prolactin. Yeah, exactly.
I've learned a lot about this just in dealing with my own stuff the past couple of years. Not that I really have any issues, but you're learning about all the numbers and what they all mean. And talk about the difference between testosterone and then free testosterone. Because I don't think a lot of people, myself included, knew there was a
You can even think about that in like the terms of like, T3 and free T3, like there's so many hormones, right? That have that free option. So let's talk about that.
Pretty much all of them. So hormones are like children. They can't be unattended at any time. So your body makes a hormone and then sticks it on a bus, let's say. Like it has to be bound to something to drive through your bloodstream and get to where you want to go. That's called a total. So all the testosterone on a testosterone bus is total testosterone. Once it's off the bus and out there, it's called a free testosterone. It's literally free and active, which means that testosterone can go to a testosterone receptor, bind to it, activate it, and turn it on. So your body has a very, 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 very small percentage that's free. The large percentage is bound up to some kind of bus. Thyroid, cortisol, testosterone, like everything, estrogen, progesterone, gets attached to something, and only a small percentage is free. It's a control thing that your body does. It can't just have a bunch of children running wild. Like it needs to keep it under control. So we check the free markers because I want to know, like, well, how much is available, active, and can bind to receptors and do the things. And I want to know the total. What's your percentage? How many buses do you have? Are you like, do you have enough on the bus to get off and become free, or is everything low? You have no buses and you have no free, and that's a problem.
What's more common? Is there not enough buses? People aren't like
making enough hormone
testosterone. They're not making enough, or there's not enough free in the sense that it's getting bound up, because that in itself can be a hormonal imbalance as well, right?
Yes. So I see a mix. I definitely see a mix of not making much hormone, period. So total is low, free is low. In the sense of testosterone, the bus it binds to is the tightest, like strapped in, duct taped, the whole thing is called sex hormone binding globulin. There's another bus called albumin, but it's only like loosely hanging onto that bus. It's like riding on the ceiling and like can jump off anytime. Yeah. Whereas SHBG, sex hormone binding globulin, it's like super tightly bound to it. Now, SHBG can increase with things like high estrogen. And sometimes when you're taking testosterone, it will raise to bind up all the testosterone that you're taking. So you will often see in like the bodybuilding world, the physique world, that they're always trying to manipulate SHBG. They're trying to get it down so that free testosterone will go up, and they're doing it through different interesting methods. Let's say that. So
that's where you get like aromatase inhibitors, right?
So aromatase inhibitors stop the conversion to estrogen. So that is also another method that a lot of men will go on. So they'll go on like testosterone replacement, and then maybe they'll do some sort of aromatase inhibitor with it. So it's a whole, we joke all the time, like, oh, men are less complicated. And in the grand scheme, you are, but you aren't. Like there is a lot of nuance because your hormones react just like ours do.
Is there any downside to men taking all this stuff?
Yes. Well, this is the big one that I will say, if you're looking to become pregnant, get somebody pregnant or have a baby. When you take testosterone, it will suppress your own production, and it will suppress your, what we call spermatogenesis, or your ability to make sperm. So if you are in your young 20s or early 30s and you have jumped on the testosterone bandwagon and you have not yet had children, it can be really tough, because sometimes they'll be like, well, I'll just stop it. I'm like, it doesn't always rebound that way. And I've had plenty of patients who tried to stop and no sperm production came back. So if hopefully you're being warned, like, hey, you're 28, you're 32, you're 37, and have never had children, either let's bank some sperm, or if you're in a relationship and now it's time to have children, now it's time to have children, because, testosterone will suppress that.
Since you just brought up that point of like, okay, well, if a man takes testosterone and his sperm, production is lower, like, what are your thoughts because there's a lot of controversy around this topic. And so I think it's something that we should talk about. What are your thoughts on like the birth control pill and doing that for women, like long-term use of that?
So I'm not opposed to the birth control pill at all. I'm glad it's available. I'm glad it's an option. It works wonderful for a ton of women. The downside is it can come with a lot of side effects. And sometimes, more often than not, women aren't told about those side effects. So while I am not anti-birth control pill, I am against giving it blindly with no like, hey, if any of these side effects happen, come back and talk to me. Like, we might need to come up with another option. So that's what I'm always trying to promote. Plenty of women go on the pill and they're like, I don't have any side effects. I feel great. I do wonderful. I went off and got pregnant right away. My cycle came back, and God bless them. More power to them. Yeah. But it's the other group. It's the other part of women who are like, it ruined my life. I really struggled. I had horrible side effects. I still haven't gotten my period back after 9 months of stopping it. My face broke out completely. I can't get pregnant. Like, it's those women. I would never want to gaslight ever. I'd be like, you're who I'm talking to and would like to support the
Yeah.
others who appear to be killing it on the birth control pill. Like, good job.
So you definitely think there is a possibility, because that was like how, for me, like when I was on it for 11 years, and like you said, like I got off of it because we were like, all right, it's time to have a family.
Mhm.
Got off of it like a little bit before we got married, and like my face broke out in acne. It took forever to get my period back.
Yeah.
And so that's not just like women out there being crazy. Like
They're not crazy. They're not crazy. And I understand why there are some educators out there who are adamantly against birth control pill 100%
Mhm.
because of these situations.
right.
However, if it's the only option for you, if it's going to save your life, if it's going to prevent a pregnancy you cannot afford,
Yeah. Right.
right? Like if you are 16
Absolutely.
and an IUD is not an option, and you can hide the pill, like I'm
That's
all
it.
about options. It is what it is. But again, I'm like, if I have a 16-year-old, because I saw plenty of teenagers in my practice, I'm like, look, we are going to check in every 6 months. If you start to get headaches, GI, weight, if you feel suicidal or depressive, like if your skin is changing for the worse, if you're feeling, like checking out of this world, you freaking call me ASAP. It's not you, it's the pill, and we're going to adjust it. And so my teenagers were like, got it. Okay. But a lot of their friends were like, had no idea.
Right.
So
Nobody told me.
side effects aside, which knowing what I know about birth control, there can be a host of those. So I'm trying to be
Yeah.
sensitive male here. But is there any empirical evidence to suggest that suppressing the fertility system for in what is many cases years,
Decades.
if not
Yeah.
decades? Is there any evidence to suggest
Like
that
he's asking about research to show that it can,
It can
cause issues with the
permanently-
menstrual cycle or ovulation.
affect the ability to get pregnant or the ability for the fertility system to work in an efficient manner?
Not that I've seen. I'll be honest. Now, somebody listening to this is absolutely going to comment in and be like, that's me. I was on the pill for 20 years, got off to start having babies, and could never get pregnant or had to get to IUI or IVF. And was it the pill? I don't know, because what I don't know is, why were you put on in the first place? Because sometimes women are like, I'm 18 or I'm 20 and my periods are irregular and I'm breaking out all the time and I'm having all these symptoms, and they're given the pill, but nobody's bothered to go, oh, you have PCOS. Let's address that, right? They're just handed and so I'm like, is fertility an issue because the original root cause issues weren't addressed, or was it because of the pill? And again, the pill is not perfect. It probably plays a role, but I would say, I don't know. I haven't seen, but I'm also not a birth control pill research expert. I haven't seen research to go, oh my gosh, this large percentage of women who go on the pill never ovulate again. Now they may take time to get their ovulation back, like you. But I haven't seen like massive infertility, because so it's very different than men going on testosterone, where it just like knocks out sperm.
Seems to run the gamut. I mean, some women, friends of mine, they've gotten pregnant a month or two later.
Right.
Yeah.
Others, it's taken,
they're
a
God's
year.
favorite. Yeah.
Right. But, just, anecdotally, most of the people we know almost
can get pregnant. But then we have plenty of friends who have done IVF. So
and then
you never know. You never know.
Causing the
issue
rates of IVF and non standard pregnancies.
And I think that in a research, I think that would be really hard to
because there's so many other
account for. Yeah, there's so many lifestyle factors, genetics, other endocrine issues, just to solely be like, it's just the pill. And I'm always saying this in everything in our body, even as something as complex as cancer, I'm like, it's never one thing.
Yeah.
It's never one thing. Humans are a system. Everything is a system. And it's, it all gets mixed into our soup, and then the outcomes happen. Just like cancer, like breast cancer, everybody's like, estrogen caused my breast cancer. I'm like, I understand, I'm being sensitive, but it didn't. It's not one thing. Like cancer is complex. Developing cancer is complex. It's not just estrogen alone working by itself to take you down.
I remember a time in my life when springtime would hit, and immediately I would be searching for a new trainer or Googling all of the 7-day juice cleanse, 14-day detoxes so that I could get myself in shape for summer.
And what I didn't realize at this time was that all of that was a complete waste of my time, of my energy, of my resources. And I look back on that just wishing for those hours and all of that energy and brain power back. The decisions that I was making for my body were coming from a place of punishment rather than from a place of love. And it wasn't until I started meditating and I started doing the work, the real work on myself, that I recognized that I needed to nourish my body with both movement and food and mindset work if I ever wanted my body to love me back in a sustainable way. And that's why the WBK membership, that I release meditations where I deeply connect you with yourself, and blood sugar balancing recipes to nourish you on a cellular level, and low impact movement to support the delicate balance of your hormones, really gets you the results that you're looking for, where it starts to become a lifestyle. It starts to become who you are. I can tell you firsthand that both myself and my members, my private clients, all of us have seen the most incredible results from the WBK method. It's so different than your typical diet and a restrictive approach that we're taught from diet culture from a very early age. As a 33-year-old mom of two, this is the leanest I've ever been, the most energy that I've ever had, and the best that I have ever felt in my freaking body. And it can be that way for you too. So right now, with the code Balancing Chaos, all one word, BALANCINGCHAOS, you can get 10% off your annual membership for the WBK method and get new weekly content, plus a library of hundreds of workouts, recipes, meditations, with a 7-day reset and a 30-day challenge, all to get you started. So use the code Balancing Chaos, again, all one word, to start your 7-day free trial and see, when you love your body back, how your body starts to love you.
One of the things that I talk about a lot, and I think that this can be really applicable to both men and women, right, is this idea of blood sugar, insulin, because I'm not sure about you, but a lot of the people who come to see me want to talk about weight loss and want to talk about why they can't lose weight. And then, they also come along with a host of other symptoms like anxiety and fatigue and all of these different things. So talk to us a little bit about blood sugar and insulin and how those specific hormones work, but more importantly, how those hormones impact all of the rest of your hormones.
Oh, yeah. Well, I'll start with cortisol. Cortisol is the big one. I always say, if cortisol had a resume, so cortisol is your stress hormone, but if it had a resume, the number one job that it would put on there is I increase glucose, I increase blood sugar. So we think of it with stress, we think of it with like handling our day, we think of it with energy, but it does so partly, mostly through glucose, helping your body create glucose.
Yeah.
So if you have a lot of blood sugar issues, you're hyperglycemic, meaning you're up and down, you're hangry, then you eat, you overeat, then you're hangry, then you overeat. Your glucose going up and down causes your insulin to go up and down, your cortisol is going up and down. So you'll never properly address that cortisol hormone if you don't get your blood sugar under control. Just like you'll never get your blood sugar and cortisol under control if you don't get your stress under control. So it's like all very intimate related. And then those two hormones, being very, very important, cycle back to your ovarian hormones or your testicular hormones. Glucose and insulin greatly affect ovarian health. Insulin, for example, when it comes out in a natural form, natural way, natural amount, it helps get glucose into the cell to be registered as and used as energy. When you have a lot of it, insulin resistance, is insulin excess, what it can do is it can bind to receptors that are androgenic, that make androgens or cause androgenic symptoms. So in a like PCOS case, they feel like oh my gosh, I have all this testosterone. I'm growing hair in places I don't want. I have cystic acne in places I don't want. I'm having hair loss on my head in places I don't want. Insulin can be a big driver in that. And similar to men, like I was saying, that aromatase. So now men have all this glucose insulin imbalance. And now they're gaining weight around the middle. They're getting man boobs. They're feeling more depressed and less motivated because insulin is pushing the testosterone to estrogen conversion through that aromatase enzyme. And so when people come, and I'm sure they do this to you, like, I'm trying to lose weight, I feel hormonal, what's the one magic pill you can give me? And you're like, I promise if I had one, I wouldn't gatekeep, I would just give it to you. But by getting their blood sugar better controlled, so they're more in tune with what's going on, however that looks, it's only going to cascade to all the other hormones.
Lovely. That was a beautiful answer. And so now is my next, $1 million question. If you could give like our audience, like, and this is, I just want to preface this for the audience. Like, this is not, like she said, like a one trick solution. It's not like going to solve all your problems, but if you could give them like 3 pieces of advice, if they wanted to start to work to balance their blood sugar better, what are those 3 things?
So the first thing is you're with anything in all your hormones, every single one of your hormones works on a clock, like the clock on your wall or the clock on your computer. So we're circadian beings. We want to be up in the morning when the sun is out. We're down at night when the moon is out. And as humans, we run a little bit longer than 24 hours. In fact, I think men run even a little bit longer. Males run a little longer than females. So every single freaking day, we have to set and reset our circadian rhythm. We do it through light in the morning and darkness at night. So why do I bring this up? Because that set and reset plays a big role in our blood sugar and insulin. And even things like our melatonin, our sleep quality, affects our insulin sensitivity, which is a good thing, or insulin resistance, which is a bad thing, the next day, our cravings the next day. So when somebody is like, I'm hormonal, I'm stressed, I'm gaining weight, I'm like, okay, stop. What does your rhythm look like? Do you get up in the morning with good energy? You should wake up in the morning when your eyes open up within about 30 minutes, 30 minutes. You should be awake, alert, and ready to go. I'm not saying like jump a mountain, but I am saying like, all right, let's do this. But if you say to me, well, it takes me 2 hours and 2 cups of coffee, I know you have a cortisol issue. And I know you have a sleep issue, right? You have a rhythm issue. And then at night, it's the opposite. We want darkness. We want off our screens and tablets and what have you, or wear blue light blocking glasses, because we want cortisol up in a healthy morning and we want melatonin up in a healthy night. And that sets our rhythm for everything. How he makes testosterone the next morning, how you and I have a menstrual cycle that month or not, how our hunger pains hit, our feeding schedule, and whether we are insulin sensitive or insulin resistant. So it's not sexy and it's not a pill. And people absolutely roll their eyes when they're I keep reading this on social media. It's such a fad. Like, it's basic physiology. It's basic. It's like, I didn't make this shit up. It's basic physiology. It's how we work as humans. And it's how does your pancreas, which makes your insulin, know that it's nighttime? Because of cortisol or melatonin, right? Like our eyes can tell it's night or day, but our pancreas can't. It's in our body. Right. So we have to follow these rhythms for a reason. How do our ovaries know? Because the cortisol and melatonin. So that's like the very first thing. I'm like, well, what's your rhythm look like when it comes to that? The second thing is tell me about, which I'm sure you do, is like, tell me like what you eat and what time you eat, right? Because I think now, unfortunately, a lot of people are like, oh, I learned about fasting, intermittent fasting. So I just drink coffee all morning. And then I'm, starving and stressed out and working, or, kids and family and running around. And then eventually at like 12 or 1, I'll have a little bit of salad with chicken or a protein bar. And then, and then. And I'm like, while I appreciate intermittent fasting, the 2 big intermittent fasting female experts in the world are good friends of mine. They would also argue we have to follow a rhythm, a menstrual cycle rhythm. And also surviving on caffeine while you're starving and stressed is not how you intermittent fast. So then it's like re-educating about feeding timing. Like, maybe we don't intermittent fast right now. Maybe we're healing some of these things. Like, the choices
I love that you
make.
brought up the difference though, too, between, and I want you to keep going with your third thing, but the difference between, because like he will intermittent fast and like,
because men have it
he
easy.
thrives on it, but like
I
can't do that. I have to eat when I wake up because we have, like you said, like that delicate hormonal balance as
Wasn't it
women.
like the time of the month too? Like intermittent fasting is more appropriate for women at certain times of the month versus others.
Yeah, the two female intermittent fasting experts in the world are Dr. Mindy Pelz and Cynthia Thurlow. She's a nurse practitioner, and they've written books on it. And they are very much like, you have to follow your cycle. Like there's times when you do and times when you don't. And as you get closer to your period, do not.
Yep.
But when you're on your period or leading up to ovulation, go ahead. And they're very clear on this. Unfortunately, what's gotten lost in the message is men thrive on intermittent fasting. So all the biohackers are like, intermittent fast, it'll fix your insulin issues. Our clients feel they have insulin issues and they're like, great, I'll just, won't eat till noon. I'll live on coffee because it's acceptable. And they feel like crap. And then their first meal is something very light, something not protein heavy, or it's a protein bar, which is because they're still running around stressed out. And it just sets the whole thing into a nasty cascade.
Yes.
So yeah,
not intermittent fasting would be your second one.
Not intermittent fasting. So the other third thing is, one of the things that drives me crazy is, now obviously not for everybody, but for a lot of people, we hear about intuitive eating, like, oh, just be in touch. But we have so much disordered eating, and we have so much under eating. So under eating and disordered eating to me are separate. You can under eat as part of a disordered eating, or you can under eat because you don't have the resources to eat, or just timing, like your day. You're just busy. Like, one of my best friends, her practice is so freaking busy. She's like, I get dinner. Like, that's what I get. It's not on purpose. She's not intermittent fasting. She's just stupid. Like, I'm always yelling at her. So she's under eating because that's her life. And so they don't have that hunger signal. They're not in tune with their body. And so it's very slowly, for some of these people, is just trying to reteach them normal physiologic, paying attention, trying to create those rhythms again, trying to reduce stress. And so sometimes it's something about the food they're eating per se, and it's more timing and checking in. It's the outside stuff, stress, their habits. And then while food is critically important, sometimes we have to build before we take away or replace or swap out. And I find that can be really helpful, especially, and I forget, I apologize, I don't know who coined it. Somebody coined it, the rushing women syndrome. Like, we're always rushing around doing stuff. And so really just checking in with that, because the more you're rushing, cortisol's up, stress is up. Now you've got your glucose a mess. Yeah. Now, obviously there's other things that are like, obviously the food you choose to eat.
Yes.
Continuous glucose monitors are amazing, but not everybody has the budget for that. There's definitely a lot of trackables and wearables that I love. But if you're just like, what's the basics I can do? I find those things really helpful.
But I think that the basics, like, they're not so basic. Like, I think that is like the biggest thing. Yeah. One of the people I was even talking to today, she was like, she's telling me like what she's eating every day. And she's like, I'm still not losing weight. And I was like, well, how are you eating? Are you eating, like, doing your emails? And like, are you sleeping? And she's like, no. I'm like running. I get up in the morning, like, first thing I'm doing is like, I get on my phone and I'm answering all these emails, and I'm like, okay, that's why. Like, and then I jump on the Peloton, and then I get my kids ready, and then I'm stuff my face in the car, and then I'm at pickup line. So I'm eating a protein bar really quick. And I'm like, do you hear yourself? Yes. No one is ever like taking a moment, like eating a meal without a distraction. Like, I think it's really, really like important to go back to those things, because if you're trying to do all the other stuff, but you're not doing that stuff as foundational, like none of it is going to work. And I have to say also, I love what you said too, about like this idea that like, everyone wants to say like intuitive eating now, but like, it is so prevalent that people have all these rules around food, 1,200 calories a day, can't eat past 7 p.m., can't eat carbs, like all of these different things. And so, as we start to wrap things up, can you give us your thoughts on that and the damage that it's doing to women's hormones?
That right there, you summed it up. The damage to women's hormones. Yes, because everything has become vilified, right? Like, and everybody's contradictory. We all follow the same people on social media. And this group is like, you're going to hell because you're not carnivore. And this group is like, you can't eat carbs. You should eat carbs because you're a woman. And this group is like, It doesn't matter if you eat at 7. And this group is like, no, you have to give yourself a couple hours to digest before bed.
Exactly.
And everyone is freaking out. And it goes back to my very, 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 very beginning thing of, I wish we just got some basics around anatomy, physiology, digestion in school. Like, here's how it works when you eat food. Here's the difference between fight or flight and rest and digest. And they don't happen at the same time. So if you're fight or flighting and you're trying to digesting, fight or flight's going to win because it's survival. So let's calm, just what you said, right? Calm, eat, let your digestion happen, and then go about the rest of your day. And so I just said this before we take away or modify, like, let's work on the lifestyle stuff, because I feel men too, because they're getting the same images and messages, but women maybe longer of like, take away calories. You have to be in a deficit. You can't eat carbs. You can't eat this. You can't eat that. Everything's bad for you. Oh, by the way, you should exercise twice a day. It's like, let's build up. Let's add. Yeah. Hold on. And don't feel guilty. And so I often find myself, and I swear a lot. So when it's my patients, I'm like, that's bullshit. Like,
Yes.
Go ahead and eat carbs. Like, we're going to work on your stress. We're going to work on all this other stuff. Go ahead and eat carbs. Don't feel guilty. Because oftentimes that guilt is so stressful to them. And so, they're like, it was Memorial weekend and I had a hamburger on a bun. I'm like, I don't care. I had a client, a patient, and she may even listen to this podcast. And she's obsessed. She's a Disneyland and Disney World. She's an adult Disneyaholic.
Yes.
And so she was mortified to go to Disney because all her favorite things, she's like, I don't know how to eat. I don't know what to eat anymore. And I'm like, nope. She had to be gluten-free, but like the park is really good for that. So I was like, you can have ice cream. Like, you can have all the gluten. You're at Disney on vacation. Just go do the thing. It's fine. Plus you're walking like 18,000 steps a day. I really don't care. Yeah. And so it took her a couple of trips to be like, look at me. I'm eating the Dole Whip ice cream. Yeah. Like, I'm doing it. And I'm like,
oh my gosh.
And now she's fine. Like, now she's sort of broken that pattern. But I thought, okay, who put it in her head that this is bad? Because they're in trouble.
No, it's so true. It's like, we should make some of that stuff illegal, like what people are out there selling and peddling on social media. Because like, I had the same thing happen. I had someone come to me on Tuesday after Memorial Day weekend, and she like literally said verbatim what you said. She was like, I had a burger. And I'm like, and then and it was like, she was like, well, like, then I felt like I was guilty for the whole weekend. And like, I was like, oh my gosh, like, give yourself some grace, like, have a burger on a Tuesday just because, like, because it's life. Like,
yeah. And especially because the people who are listening to this and the people who are seeing you and seeing me, they're making the changes, like, we're not talking about somebody who's not trying or not making the changes. We've all seen those people, unfortunately,
who don't put in effort
at airports or Walmart. And you're like, ouch, you could probably use my services. We're talking to the people who are really working hard. They're like putting serious effort into thriving in life. And so they're not eating the bun on the hamburger, or they haven't been. And so that's who we're talking to, of like,
and that's why it feels like, it's guilt. Like, there's guilt around it because they've been trying 100%.
They've been so trying. And we're trying to, reverse that a little bit. Grace. I love that you said that. Grace. Yes.
Yes. So tell us a little bit about, we like to end our podcast by asking our guests, like, what do you do? Like, what's your day-to-day look like? Like, and how do you take care of yourself? And how does that kind of, look in a morning and evening routine?
Yeah. I will say, so I have been in this business since 1999. So a really long time, 24 years. And I always want people to understand that I am in the 24th chapter of my health and holistic journey. So if you're listening to this and you're like, wow, that's a lot, or that's more than me, or I'm only in chapter 2, like, do not compare, because 24 years versus just starting out is very, very different. So I do not strive to be perfect by any stretch, but I'm very conscious in my, like, cleaning products, makeup products, skincare products. Where I live in the Northwest, we have a lot of forest fires. So we have air filters in the house. We filter the water. We have a clean mattress that we got a couple years ago, finally. I've made a lot of upgrades in my life, because I'm aware the chemicals are a big problem, and I'm aware that what I put on my body and in my body and on my body and around my body makes a big impact. I can't control the outside world, but I can control my yard, and I can control my house and things like that. But again, it's a 24-year journey for me to make these changes. And if this is video, you will full on notice I have fake nails on. So I do all the things so that I can have fake nails, because I really like fake nails. So when somebody says, "Oh, you're not perfect, you have fake nail," I'm like, but I'm okay with that. My liver totally knows what to do when I get fake nails every 3 weeks. So thank you very much. And then dietary wise, I'm celiac, so I don't eat gluten, I don't eat soy, and I don't eat a lot of dairy, but you better believe I will eat all of the dark chocolate in this world. So like you said, balance. And so that's what I've done over the last 2+ decades to get me to where I'm at. And so we're recording this in June. Also, I'll be 46 this month. And I think I'm doing pretty damn good. I wake up every morning with great energy. Thank you. I also have a really good camera. I feel really pretty good. Knock on wood, my hormones are doing pretty good. And I'm going to try to maintain that, because my family lives a long time. My grandparents, 3 of my 4 lived until their late 80s, early 90s. And so longevity is in my genes, and I need to do it thriving versus in a wheelchair and a walker, not doing well, in a dementia unit. Like, I like to avoid all of that. So
Totally.
I've been doing this a long time.
What about diet wise? Eat meat, eat fish.
I eat meat. I don't eat a lot of fish because I wasn't raised with fish. And so I did not get that
cultural
seafood thing. And then I moved to the Northwest. So I like salmon. I like salmon, crab, lobster. But then I learned all about the parasites and metals and the fish. And I was like, no, thank you. Probably a good thing I didn't grow up obsessed with fish. But I do, where I live, I went and bought a little freezer for my garage. So we have half a cow. We have a free range ranch near us. And so we have free range meat. And I try to buy organic when I can. I know it's not always available and not in everyone's budget, but just trying to reduce pesticide exposure and things like that.
It's just so hard in restaurants, I find.
Yeah.
Getting sustainable and
but you think about too, the way that I think about it is it's like we eat home 5 nights out of the week.
That's what I'll be honest.
I eat lunch out a lot.
You do.
Busted. Yeah, I cook. I cook a lot, and so my husband's good at a lot of things. Cooking is not one of them. So I do all the cooking, but same thing, right? It's the reason I get my nails done. I've made all these other changes. I know how to take great supplements and to take care of myself. So if I do go eat a gluten-free burger at a place, but it's not free range meat, it is what it is. I just do the best I can and move on. And I don't have a lot of guilt over it. I'm probably going to eat some of the French fries, even though it was probably cooked in peanut oil. It just is what it is. I take antioxidants and do the things. So yeah.
So Dr. Carrie, tell all of our listeners where they can find you, if there's anything that they should look out for, if they want to get to know you more and get on your website.
Yeah. So I hang out a lot on Instagram. I am at dr.carriejones. My website is drcarriejones.com. And I am just starting to dip my toe into TikTok. Good luck. Which is at Dr. Carrie Jones. So awesome. That's where you can find me predominantly.
Wonderful. Thank you so much for spending time with us. I feel like we could talk to you all day about all the different hormones. This is fantastic.
100%. Thank you so much.
Thank you. I appreciate it.
We really hope that you enjoyed that episode. You can follow me on Instagram at Wellness by Kelley. And if you're new around here, you can sign up for the WBK 7-day free trial, where you can get access to all of my low impact workouts, blood sugar balancing, plant-based recipes, and guided meditations, all available on wellnessbykelly.com and on the WBK app.
Hey, thanks for listening.
Please make sure you rate, review, and subscribe to the podcast. You can also connect with us on social media at Wellness by Kelley. Drop us a DM for who you want to hear from.